Joining us for more on the heroin epidemic and how more federal funding could help combat the problem is U.S. Congressman Vern Buchanan, Samantha Kolb, Director of Centerstone's Addiction Center, and Dr. Sherry Gooding, Clinical Director at Coastal Behavioral Health, right?
Yes, sir.
Around the corner from us. Welcome to you all. And Congressman, let me start with you because you really taken on this issue on the congressional level. And what brought you there?
About 5 years ago, there wasn't something on my radar. I had 3 mothers walk into my office in Sarasota. All of them lost their kids to the drug epidemic in terms of pill mills and everything else. It was a big issue. We had 1,300 pill mills at the time. We've worked together, state and federal, to shut down a lot of those. But now it's led to heroin and fentanyl and carfentanil, with terms I've never even heard of before. So it's a big issue. We thought we'd made a lot of progress. But when Manatee County's had a 900% increase in 5 years, #1 county in the state for heroin deaths, that's very concerning. So we're going to do everything we can. We've got a bill that we've put forward, myself as a co-sponsor and others. We hope to get funded by the end of the year, about $500 million. We need more resources. But our goal is to work with the local experts, and my job is help bring those resources, and then we'll also hopefully get some support from the state level as well.
We're going to dive into the federal funding in our next segment, but it does raise the question of the law of unintended consequences. Is the increase in heroin overdoses directly related to the state and federal effort to shut down the pill mills?
Absolutely.
Direct correlation.
I mean, was there what did you see in terms of the time frame when the state really became more effective in shutting down those pill mills, and then the increase in overdoses?
Well, what happened is the pills that were on the streets before now became less expensive, or actually more expensive. I'm sorry, and
that's all right.
I'm sorry, I'm nervous. And addicts, needed to get their fix, so they would try to get the pills. They were paying $30 at least for one pill. Eventually couldn't afford that. And so heroin was much cheaper.
So Samantha, could you explain the underlying causation that addicts are going, if not from pills to heroin, other illegal narcotics, if it's not one thing or the others? What is the underlying reason?
Underlying reason someone would become addicted?
Yeah.
There's a few different reasons why someone become addicted. Some people had an injury, maybe from sports or daily life, and they were prescribed these medications not thinking they'd be addicted. They became addicted. Other people use it as a self-medication for maybe a mental health issue or life stressors that are going on, and it just spirals out of control.
And Congressman, there's really been kind of a change in terms of whether it's state government or federal government and the thinking of lawmakers in terms of how to handle this. Back in the 80s and 90s, it was, throw them all in jail. But there's been kind of an evolution in terms of thought.
My thought is I'd like to see as much of the money go into prevention. We were talking earlier, we have kids that are 6th and 7th grade getting addicted, and then you see the results, they're dead in their 20s and 30s. We've got to do everything we can on the prevention front. I mean, the money we're looking at is going to do prevention, treatment, and also rehab for a lot of them. But the bottom line, we've got to deal with this prevention piece. And I just tell you, I do a lot of town hall meetings in Sarasota, Manatee County, and this is maybe 4 or 5 months ago, mothers coming up to me and just saying basically, what are you doing about it? And our kids are dying on the street. And
we're going to get more into that in our next segment, but we have to take a quick break, and when we return, we'll have the latest on Hurricane Matthew. Welcome back. If you're just joining us, we are discussing the heroin epidemic and the push for federal funding. Our guests tonight are U.S. Congressman Vern Buchanan, Samantha Kolb, of the Director of the Centerstone's Addiction Center, and Dr. Sherry Gooding, a Clinical Director at Coastal Behavioral Health. Thank you all again for joining us. Congressman, I want to talk to you about the Comprehensive Addiction and Recovery Act that was passed this past summer. What is it designed to do?
Basically, it passed the House and the Senate, got authorized about $500 million. It's basically for prevention, education, and to deal with the borders, where a lot of the drugs are flowing through. So that's the main issues in terms of that. But my job, as I mentioned earlier today, is to make sure we get those funds here to Manatee County. We have a 900% increase in deaths in the last 5 years from heroin overdose, and it seems like it's getting worse every day. In fact, I said yesterday the Bradenton Herald came out and said it's the death capital from heroin in the state. And I can't imagine it, but that's the reality, and that's where we're at right now.
Why has the funding been problematic? I know it's difficult to get anything through Washington, but I believe the president asked for $1.1 billion in funding, but it was the bill, when it passed, did not actually have much funding in terms of the things that you wanted to fund.
Well, there's two steps. You got to get the money authorized. I think when we get there in November, we were talking about today with our staff, we think we'll get it done. I don't know we get to $1.1 billion, but I think we get to $600-700 million. I'm going to do everything we can to make sure we get it quickly and early, and make sure we get the money back here to Manatee County, as well as Sarasota. But Manatee County has the bigger challenge.
But this is not just a Manatee or a Sarasota problem. You hear these stories across the entire country, which is probably why the passage of the bill was so bipartisan, because representatives and U.S. senators have this issue in their own districts. But is it one thing to pass the bill and then another thing to get everybody to agree in terms of the money that will actually go out in terms of these programs?
No, I think, as you said, Alan, it's a bipartisan bill, Democrats and Republicans across the country. I think in Florida, everybody was on the bill. I co-chair the delegation. We had hearings on this. I think everybody's on the bill. So I don't think it's a question of that. It's just a matter of getting the resources we need. And you made a good point. It's not just Manatee County. It's statewide, but Manatee County seems to be the epicenter of it. And it's a big national program. You can imagine LA, New York, and other places. And it seems to be getting worse. And I think it's getting worse is because of, you used to buy a pill for $30. We ran a lot of those people out of business. Then we got into the whole thing where you can get heroin for $10 a bag, and then now they're in fentanyl and other things that are much more addictive. And just to take one case in point, if you look at heroin, to buy, which I always thought was the most addictive drug, fentanyl is 50 times more addictive, and carfentanil is 100 times more addictive than fentanyl. So it's a big issue and a big challenge, and we need the resources quickly, along with the professionals here locally. We've got to work together as a team.
Samantha, why is there such an acute problem in Manatee as opposed to other metropolitan areas like Sarasota or elsewhere?
Yeah, I don't know if we have the answer to that. I think we wish we did. And so right now we're trying our best just to pull the resources we have together to treat and help those that want the help and need the services.
So coming out, if you were to get more funding and if the community would get more funding, Sherry, where would you like to see that money spent?
I would like to see it spent in prevention, as Congressman.
Well, how do you prevent?
Go out to the schools, start talking to children when they're very young, educate parents as well, what to look for, to help them seek the help that their children may need.
And
Alan, let me add one thing. I think, and all of us are touched by this, our family, we were talking about this earlier, you've got to prevent it from happening in the first place, because once they get down the road, if they get very far, good chance they're going to end up dead. And so when you got kids in the 6th, 7th, and 8th grade, we've got to stop them from even considering drugs. And I think I'd like to see as much of the resource go that way in terms of prevention, because I have personal stories in our own family where once they get down the road too far, it's very tough to bring them back, and the parents are worried about them getting a phone call in the middle of the night that their child is dead. So that's my general feeling.
We saw in Bo Beth's story that local law enforcement, they do not want to go out and just arrest people. But there are people who are watching this tonight who see people struggling on the streets, and they just simply want them off the street. What would you tell them?
Well, I think every community has resources. There's inpatient resources, outpatient resources. A new push is medication-assisted treatment, which is an option for folks to get on an opioid replacement so that they can continue to live their healthy lives without maybe going inpatient. So it's an option. It's in infancy, so I think we're going to see a lot of growth in that area.
Part of the bill that was signed into law includes treatment for incarcerated addicts, because there is, almost a cyclical thing. People get picked up, they get into jail, they wind up back on the street and right back doing this kind of thing. Congressman, when you're talking to law enforcement agencies around here and the courts, which is a big part of it, and the jails, is there a recognition that more has to be done when people wind up in jail to give them treatment so they don't reoffend when they come out?
Yeah, well, again, very good question. I've talked to Tom Knight, who's a sheriff, as you know, in Sarasota County. They move them in and out of the jail constantly. Manatee County's actually got a better system, in my thinking. They work closely with your organization. They pick them up on the street instead of just putting them into jail, which then they release them a day or two later. They move them many times over to their facility, and they can get real help. And I think that's where they need to have more funding. I was just at a groundbreaking the other day. They added probably 20% more facilities in Manatee County, which I think is exceptional. But I think you got to work closely. You know, all the stakeholders in the sheriff departments, you know, have a big challenge. You just can't put them in and out of jail, put them in jail a couple of days, dry them out, and put them back out in the street. They're actually working with facilities like both of these in Sarasota, Manatee County, to put them in there, get them some treatment, and hopefully get them on the way of dealing with their challenges.
And Sherry, you're on the front lines of this because they wind up at your door. And the one thing I have often heard on the statewide level is that Florida ranks nearly last in the country in terms of mental health spending. And does that play a big part in what the problem is?
Absolutely. I think addiction and mental health go hand in hand. You can't treat one without the other. Also, you were talking about criminalization. So the problem is once they go to jail or do a prison sentence for a felony charge, then when they come back out, they can't get a job, they can't find the money to take care of their family, so a lot of them go back to dealing.
That is true, but what I often hear about from people on the streets, there's a segment of the population on the streets that you can reach, and there's a segment that don't want to be reached.
Correct.
And what do you do about that?
Well, we do the homeless outreach. We go out and see people on the street. We offer them treatment at Coastal. Most of it's free services. Get them housing, get them involved with the Sarasota Police Department. So many of them are suffering from chronic mental illness, schizophrenia, bipolar disorder, and then they're using other drugs on the street.
Congressman, is there anything else that can be done on the federal level in terms of perhaps even law enforcement on the federal level to crack down not only on the heroin coming into the country, but also these other substances that are now taking over or being mixed with heroin, like fentanyl and so forth, to get to the source of those and cut it off?
Let me just comment on one thing you just said about mental health. We had a facility state-funded in Arcadia, DeSoto. They closed it. They said they didn't have the money. A lot of those people ended up on our streets.
Yes.
You see the homeless and everything else. So it's a big issue
and
from that standpoint.
That's happened around the entire country.
Yeah,
So
but I'm just looking at our region. And then if you look at the idea that we did pass a bill in the House, which I think will get dealt with in the Senate, where it's a mental health bill. It's going to be $125 billion. That's what we're spending. They haven't done much changes on the funding since JFK. So I want to be hopeful that we can take best practices, redeploy the resources so it'll make it a difference. The other thing I want to say in terms of drugs coming over into the U.S., 90% our numbers are coming from Mexico. The other percentage is coming out of South America. We are looking at a lot of the funding to go towards interdiction and stopping the flow of the drugs into the country. That is a very big issue and a good point that you brought up.
Right, and we'll pick up on that in just a moment, but we'll have to take a break, and when we come back, we'll hear from final thoughts from our guests. Welcome back. How could federal funding help combat the heroin epidemic here on the Suncoast? That is what we are discussing, and we will conclude with our guest. Congressman, you talked about you still hope to get that federal funding for the heroin part of this. When? Congress is not coming back until after the election, so are we talking about the lame duck?
We're talking about the lame duck, November. It could go December 15th. In that period of 4 or 5 weeks, we'll get it done. And then you mentioned earlier about mental health. I think first part of next year. It's $125 billion. We haven't done much in this space for 50 years. We passed in the House. We're hoping to pass that in the Senate. But I feel very good about the heroin getting passed, having the funding, and getting money down to our region, and especially Manatee County.
You know, a lot of times when whether it's Congress or the state legislature, and you get into these time pressure-packed, end of the legislative sessions, it's very hard because there's so much that has to be done. Have you gotten any indication from your leadership whether they're willing to push this along?
Well, I think the heavy lifting's been done. It's passed the House, the Senate. It's been authorized. So now it's got to be appropriated, and I expect that's going to get done. They're telling me, in the last 6 weeks of the year.
And if you got an infusion of funds locally to work with addicts and for this prevention, how soon would we be able to see the impact of that on the streets and the headlines that we continually hear about deaths?
Well, it depends on where it goes, treatment, prevention, but I think immediately, prevention not necessarily immediately, it's targeting the children at, school age. But treatment you would see immediately.
Right. And let me just add, I would look to the community as we get the funding, grants and other things, is that they have a plan on how they're going to best utilize those resources, because the taxpayers are going to want some results. We need results in Manatee County and Sarasota County. So that's what I'm going to work closely with them on. What is your plan? How are you going to use the resources? How are we going to maximize whatever dollars we get so we get the best return back to the citizens of our counties? And
I would imagine in terms of a short-term fix, the Narcan part of it, that this will provide funding from that gives law enforcement officers and EMTs at least something to actually save lives on the spot.
Yes, and family members.
Okay. Let's end the conversation there, but before we go, we want to share with you what some of our viewers are saying about last night's show. We had an analysis on the first and only vice presidential debate between Senator Tim Kaine and Governor Mike Pence. A CNN ORC poll of viewers found the majority of people believe that Pence came out ahead in the face-off. But we asked you, our viewers, what you thought in terms of who came out ahead. Doris Harker writes, Pence, he sticks to the facts and doesn't lie, even though Kaine was rude and crude and interrupted him about 70 times. And Billy Brooks Jr. writes, Tuesday's debate showcased a vice presidential nominee who couldn't defend his running mate. You can't depend on Donald Trump's behavior and recorded statements. Well, if you'd like to join the conversation about tonight's topic, just visit our Facebook page at facebook.com/news7. I want to thank our guests for being here tonight. Vern Buchanan represents the Suncoast in the U.S. House of Representatives. Samantha Kolb is the director of Centerstone's Addiction Center. And Dr. Sherry Gooding is the clinical director at Coastal Behavioral Health. When we return, we'll bring you up to date on what is making news at this hour.